Okay, so here we have Dr.
Ugra.
Cardiologist.
Yes.
Ugra. Yeah. And you're a cardiologist, right?
Correct.
Okay. And what's your hospital name? What's your hospital name?
Royal Columbia Hospital.
Okay. And I got a business card here too.
Okay, thank you.
So let's start with Q&A. Okay. So first question. Do you get nervous before surgery?
Yes.
Really?
Yes.
I was not expecting that. Okay. Yes.
Did you ask why?
Why?
Because you want to do a good job. You don't want to mess up.
Would you get sued if you mess up?
Potentially, but rarely. You're more concerned about somebody's life than you are about getting sued.
That's true. Okay. So, second question. What is the difference between a cardiothoracic surgeon and a cardiologist?
So, cardiologists will diagnose heart disease, right? So, when somebody comes into the hospital and they're having heart symptoms, they see a cardiologist first, right? And we deal with sort of three things. One is rhythm disorders of the heart, so heart rhythm, pulse. We deal with valve issues. So if somebody has valvular heart disease, the heart has 4 valves. And we deal with coronary disease. So that's the blood supply to the heart. Okay. And cardiothoracic surgeons typically only get involved if somebody needs open heart bypass surgery to fix a blockage. Actually, multiple blockages. Usually, cardiologists can open up 1 or 2 blockages, but a cardiothoracic surgeon is required for open heart surgery, which is something I don't do. They do.
Oh, okay. So, how long have you been a cardiologist?
5 years.
5 years, okay. And what tools do you need for surgery? Like, do you have a choice or something?
There's many. If you are doing a procedure, whatever you need is brought to us. Like there's hundreds of balloons and apparatus and whatever tools we need are sort of prepared for us before the procedure.
Oh, okay.
So ask him what kind of balloons are they?
What type of what?
He told you about the balloons. What kind of balloons are they?
What type of ones are they?
So it's essentially like if you look at a pencil, there's a balloon at the end of a tube, and we pass this pencil to the area that's blocked, and then we blow up the balloon at the end. You have a balloon here, right? And that would help us open up the area that's blocked, and then we would put a tube to open up the vessel and take down the balloon.
Oh.
That's what's called a stent.
Okay. And what symptoms would you need for like what symptoms for heart surgery?
What kind of symptoms would people have? Usually chest pain.
Oh. What do you specialize in? Just like.
So I'm a specialist in different ways to image the heart. That's what my specialty is.
Oh.
And keep your blood pressure very low, and you could never smoke. All right?
Okay.
Those are 3 things we do to prevent heart disease.
Do you have a signature technique that nobody has?
No.
Why do people get heart attacks?
Because they have high blood pressure, high cholesterol, they smoke, or they have bad genes, family history.
Oh. Why do people get cholesterol?
Why do people get cholesterol? It's usually a genetic issue, or it can be a diet issue.
Okay. So what are pacemakers?
So if somebody has a rhythm abnormality, as in as you get older, sometimes your heart doesn't beat as fast as it should, a pacemaker takes the place of the normal, what we call the sinus node. The normal beat of the heart is regulated by a device called a pacemaker. And pacemakers are very small now. They're the size of a toonie.
Oh.
Be like, can you put it in?
What?
Be like, do you put it in?
Yeah.
Do you put it in? Really?
Yeah.
Oh.
And it goes in through where?
Through a vein.
Through the.
Right.
Right.
Okay, so I think that's it for the Q&A.
Are you
I
sure?
don't think I have any more questions.
Good.
Yeah. Done.
So this is the specialist room, right? So we talk to patients here, the doctor sits there, we examine patients if we need to on the bed there.
Okay.
And this is the counseling room. So if somebody has a problem with their diet or emotional issues, they can sit in the chair and we can talk about problems here. That's the counselor's room. This is our stress lab. This is for heart tests. Okay. So this is what's called a Holter monitor, and a Holter monitor monitors your heart rhythm for 24 hours. Okay. So you put these two leads on, and you wear this for a full day. Okay, and it monitors all your heart rhythm. Okay, and then we download this onto the computer, and we can see what's going on with somebody's heart rhythm and whether they need a pacemaker or not. Okay.
Cool.
This is a stress machine. Okay, so it's not just a treadmill. This is a special type of treadmill for heart patients. Okay, so they walk on the treadmill, and we get readings here that tell us what. I'll show you one now. Okay, that's an ECG. So these are the heart tracings that tells us if somebody has a blockage that needs to be opened up, right? Whoa. So we diagnose coronary disease with this. All right. So this is the stress lab. Okay.